there is the Human Glycome Project. So can you explain, okay, what is the glycome? And then what is the aim of the Human Glycome Project?
So we started Human Glycome Project, I think, nearly 5 years ago. The pandemic slowed it down a bit, but we will just have our next meeting in November in Croatia. And the idea was that we do something similar to the Human Genome Project. So the Human Genome Project had a task to sequence the human genome. So the Human Glycome Project has several specific tasks. One of them is to understand all the glycan structures which are present in humans, to understand the inter-individual variation, because one of the largest molecular mechanisms of inter-individual variation are glycans. So glycans are what makes us different. Even the blood groups, A, B, and O blood groups are chemically glycans. Just we call them blood groups, we don't call them glycans. So we are trying to understand, what makes people different. And one of the first aims of the Human Glycome Project was to analyze glycans in 100,000 people. And we achieved that goal 2 years ago. Now our next aim is to go at 1 million people to understand how glycans explain variation between people, how glycans explain disease risk, and what will happen when one gets ill, the response to different therapies, and so on. So we are trying to accumulate information about glycans in humans and how this reflects on both normal physiology and on disease development.
How is glycosylation related to diseases? What can you predict that a disease is coming, especially a disease of aging, based on the glycosylation?
So the majority of diseases associate with changes in the glycome. So whenever we look at patients and controls, there will be differences in glycosylation, because the glycans are affected by genes, by environment, by epigenetics, and usually disease affects something of that. In some of the diseases, changes in glycans happen up to a decade before disease is being diagnosed. And we have so far analyzed over 150,000 people in my lab. And we have shown, for example, that we can see changes in glycosylation at least 7 years before people develop insulin resistance and go into the diabetes direction. So 7 years before initial diagnosis, we can already see changes in the glycans. In cardiovascular diseases, we can also see kind of a risk factor. So people who will have a heart attack or stroke in the future will change their glycans up to 10 years earlier. So many of these diseases, which are called age-related diseases, change glycans up to a decade before people get ill. And the reason why we think this is the case is that these IgG glycans, they regulate low-grade chronic inflammation. So we know that inflammation is something contributing to many diseases. So as we are getting older, actually inflammation is becoming one of our key enemies, because when we are young, we keep inflammation under control. And one of the mechanisms is that we have these IgG glycans which suppress inflammation. As we are getting older, we are losing these inflammation suppressing glycans. And then we have more and more low-grade chronic inflammation. And then depending on a genotype, epigenetics, environment, it can end up in some of the diseases we know. Because, disease name is something established 100, 200 years ago based on a diagnostic criteria available then. So more or less symptoms and a location, and then you have a disease name. And today we know that many diseases have the same or the shared molecular mechanisms, just manifestation will be different in different people. So glycans here can help us to predict what is going on, because this change from inflammation suppressing to inflammation promoting glycans happens with a different pace in different individuals. And one of the key elements which decide the pace is a lifestyle. So if we live a healthier lifestyle, the glycans change slower from young to old glycans. And if we have an unhealthy lifestyle, they're changing faster. And the key thing is we can actually make a decision. We can change our lifestyle. And by changing the lifestyle, we change the glycans, which are contributing to disease development. So we can actually make a decision to postpone diseases by changing our lifestyle. And this is nothing new. So we all know that. If we live healthy, we will be healthier. But, majority of people don't do anything because, we have to invest today, time, effort, being hungry or whatever. And then we got rewarded in 2 or 3 decades. And this does not work for human psychology. So I will not give up a small pleasure today for better health in 20 years. But if there is a quantifiable tool which will tell me today, what you have done in the last 2 months did some damage to you or did some good to you, then people get motivated more. So this is what we see with the people analyzing their glycans. They look kind of older and then they're unhappy, why am I older? But then they think about it, they change some elements of their lifestyle and things get better. And key thing here is that without objective molecular tool to look what is going on inside ourselves, we don't know what is actually good for us. Just if we think about the dietary recommendation, they're today exactly opposite what they were 15 to 20 years ago. So obviously, we don't really know what is good for everybody because nothing is good for everybody. We are all different. So, there are people who can cope with a relatively large amount of carbohydrates without doing much damage to their health, while others cannot. Their glucose just explodes if they eat carbohydrates. Low carb diet, which is now being promoted, is also not good for some people because there are some people who get, actually they can be harmed with a keto diet. So I think it's very important to develop tools which will enable us to see for ourselves, how do we respond to different diet, to different exercise, to meditation or whatever, because we are not all the same. There is no standard human. And all the recommendations are based on a standard human, 70 kilograms white male, and everything else standard. That person does not exist.